My name's Harry Callaghan. I was born in Dunguddy country, but I also have connections to Gumbaynggirr, Biripi and Warramai. My mum and dad split up when I was young, and that sort of took its toll. We went to live with Nan and Pop, and did my own thing. Didn't need any expensive toys, just a bush. Yeah. Oh, well, I'm the Aboriginal Health Promotion Worker with Gandangara Health Services, Maramali, yeah. So what I do is I develop and run programs in the community, targeting teenagers at the moment. So, get them out, get them active, get them healthy. Yeah. Separation from my wife years ago sort of took its toll, and I didn't understand, and so I went and got help, and then that's when I was diagnosed with depression. So as a typical male, I went into my own shell and hit the alcohol and didn't want anyone around. So, and that made me worse. So I just, it was hard, and now I look back, I should have got help earlier. It was a challenge just getting to sleep at night, but I guess one of the successes was that I had a job, and I just had to get up and go to work. Reconnecting with family was just one of the things that sort of helped, and sometimes I'd go, just on my own. Go out and sit on the headlands at Saltwater, or even Hat Head up at Kempsey and Saltwater near Taree, and just sit there and think about things and think about cultural stuff, and that sort of gave me strength again. I used to paint before I became depressed and went through the mental health stuff, and I just stopped. I just couldn't find the energy or the will to keep painting, And someone came to me one day and said, "Oh, are you still painting?" And they said, "Oh, look, we're looking for about $600 worth of art." And I thought, "Oh, yeah, okay, yeah, some living money." So that basically sort of motivated me to get back into it. So when I did, it sort of felt good, you know what I mean? It took me from that space inside my head to just out there, because every time I paint I just drift off, and in a cultural sense. I think culture plays a major part in recovery from mental illness, and if you're reaching out for your culture and it's there and you know what it is and you know what it's all about, I think that provides that comfort zone. I think mental health is just about not understanding and your emotions and your feelings, and it's not about not understanding, but it's all about not sort of noticing what's going on, and people don't recognise the signs, and that's the sad thing, Oh, look, there's counsellors in basically every AMS, down with our clinic, Gandangara, Tharawal, and that just sort of gives you that comfort zone, like the cultural comfort zone that, because you're in an Aboriginal organisation and you're culturally safe and confident to go in there. We have a counsellor down in where I work, and she's awesome. But you know, any GP could refer you to a counsellor or a psychologist. Yeah. So you know, go to your GP if you feel something's wrong. Go to your GP, and you know, they'll set you on the right path.